I think our input is really important. I think when the administration gives students a chance to really give them feedback and actually apply it and make it better for the people who are coming after us, I think it's beneficial to everyone.
We have had students as a component of the planning phase from the beginning all the way in through the implementation phase.
We've had students involved in the course development teams throughout the last several years. They were heavily involved in the course conceptualization. There are student members appointed to each of the course implementation teams. Those are students who are found from various campuses around our state system.
When I entered IU School of Medicine, my goal, as well as many of my classmates, was to make sure that the IU School of Medicine was better for having had us for these 4 years.
If you want to train in an academic health center environment, we have that. If you want to train in a community health environment, we have that too. If you'd like to train in rural medicine, you can get every possible scenario that you want for medicine here, right within the School of Medicine, and you can mix and match them to tailor to your needs for what you're going to be doing for the future.
Statewide, I think as a school, we've been taking the fact that we're so spread out and really making it feel like a family. With the college and house system, with some of the new initiatives that even students have started with the second year show.
At the IU School of Medicine, there's such a large system of opportunities here to interact with patients. It's been a strength, but also something students have recognized as to build on in the future.
Part of that's why I came to IUSM Muncie, is that we get really early clinical interaction since we're so close to Bell Memorial Hospital. And that's been a huge help to me. It reminds me of why I'm coming to medical school, and it gives me kind of a drive to get through the next test this week.
The benefit of peer-to-peer interaction in the new curriculum is the opportunity for medical students to talk about cases with each other. Being able to talk medicine with your peers, it's kind of cool. It's one of those things you start to get into in the later years of med school, and definitely it's important for residency.
The new curriculum is going to help us with teamwork and lifelong learning. Moving forward, medicine is a team sport, wholly and completely. We work with physician assistants, nurses, nurse practitioners. Knowing how to learn from each other is going to promote lifelong learning. Knowing how to detect your own weaknesses and things that you may not be as great at is going to promote lifelong learning.
The new curriculum's benefits in terms of preparing you for residency go back to, again, starting from the beginning, starting from first year, and allowing you to interact with patients better, talk medicine with your peers better, learn to teach yourself better, because that's what medicine's about.
A very important part of the medical education is discerning what field you want to go into. As a first-generation college student even, I don't know who to contact or where to go to for those areas of support. So having that earlier on, I think, is going to facilitate students to learn what they like, what they don't like, what they're good at, and what they're not.
I think that our students are going to be very well prepared to, with the changes that come in healthcare, and even more so, are going to be even better prepared for any future changes. So they're going to be resilient in the face of any kinds of changes that come through healthcare, that ones that we know about and ones that we don't know about.
Just to be able to take part in this experience and see the development in my first 3 years, I cannot wait for the last 5.